I'm Dr. Fiona Lovely, and this is the Not Your Mother's Menopause podcast. I'm taking the taboos of menopause and perimenopause and bringing light to the dark. No bullshit, no shame. It's time for us to gain a new paradigm in female health, out with the old and in with the new, and I'm bringing fresh perspectives from someone in the arena. I've been practicing women's health for nearly 20 years, and I'm spilling the tea on what it means to live at midlife, knowing that the best is yet to come. I'm sharing my Gen X approach to living through this transition. Sassy, a bit sweary, and always honest. Tactical tips and instantly usable information is my aim. I hope to make you laugh and that you learn something new that helps you embrace the change. Together, we bring power to the peri. Onward to the podcast. Hi, listeners. Do you know that experience where maybe you eat something you haven't eaten before, or you're in somebody new's house or a new building, or you're out for a walk and you start having low energy, heartburn, congestion, anxiety, bloating, itching, body aches, and flushing? I know I have, and I've watched other people have that experience too. Well, you know what? That's a sign that your histamine is dumping into the system. And what the heck is histamine? Well, it's a normal part of the immune response. It's part of the immune system and its responsiveness to the environment, which of course is exactly what it does. But it turns out that histamine, when we have too much of it, to simplify it greatly, can be a real problem for a lot of people. And this is something that I'm so happy to address on the show because we do see this get worse at perimenopause for some women. And yes, it's about histamine metabolism, but it's also about gut health. And here we go again, having the discussion about gut health. So today I'm bringing back an old pal to the show, Dr. Meg Mill. Dr. Mill is a pharmacist, has a pharmacy doctorate, and is a certified functional medicine practitioner with over 2 decades of clinical experience. She is also a best-selling author, podcast host, summit host, and sought-after corporate wellness speaker. Her virtual functional medicine practice has transformed the lives of hundreds of clients worldwide by connecting the dots between their diverse, unexplained, and often overlooked health struggles. She uses her EAT method to uncover and resolve the underlying connections, whether it's histamine intolerance, hormone imbalances, gut dysfunction, or mast cell activation syndrome. She empowers clients to regain control of their health, to regain the energy, mental clarity, and confidence needed to fully show up for their lives again. She has been seen in national publications and on media such as Fox News Channel, ABC, NBC, CBS, CNN, Forbes Health, Reader's Digest, Health Magazine, Mind Body Green, Authority Magazine, Life and Style, and Sunset Magazine, as well as several national publications, blogs, and podcast guest experiences. And just like her bio says, Dr. Mill is here to give us a complete understanding of what's happening when the nervous system goes sideways. And of course, this can include the mast cell activation syndrome that perhaps you've heard about this. There's been a lot of talk about mast cell or MCAS since the pandemic, since the coronavirus was introduced to us. So Dr. Mill, as she likes to be called, Dr. Meg, is here to share some information I think could be really helpful for some very confusing symptoms which many women in perimenopause can experience. So without further ado, here is Dr. Meg Mill. AG1, the way I start my healthy days. With my AG1, I get a daily dose of vitamins, minerals, pre- and probiotics, adaptogens, and more. It's daily self-care for my busy life. It helps me fill the nutrition gaps, supports immune health, and supports gut for healthy digestion. It's once a day, easy to drink, and packed with bioavailable ingredients and a convenient formula. I am proud to have had AG1 as a sponsor of this show for many years. It's a nutritional supplement I stand behind and I take every single day. Start with AG1 and notice the difference for yourself. It's a great first step to investing in your health. Try AG1 and get a free bottle of vitamin D3, K2, and 5 free AG1 travel packs with your first purchase at drinkag1.com/Fiona Lovely. That's a $48 value for free if you go to drinkag1.com/Fiona Lovely. Check it out. Welcome to the Not Your Mother's Menopause podcast. I'm Dr. Fiona Lovely, and I'm welcoming back a friend, Dr. Meg Mill, today. Meg, thanks for coming back to the show.
Thank you so much for having me.
Oh, it's my pleasure. It seems to me we've had a lot of changes, both of us, that have happened professionally since we last spoke, and busy times, right?
I know, yes. And you know what? It's so interesting because today we're going to talk about histamine intolerance and mast cell activation syndrome. And one of the things, we talked about headaches and migraines last time I was on the
Yes.
show. And one of the things that really strongly contributes to headaches and migraines that people aren't even understanding is histamine intolerance. And some of that work actually led me to really dig further and along with some of my own health issues into the subject of histamine intolerance and mast cell, which really is not well understood in the medical community. So it's one thing we really want to bring more and more awareness to.
Oh, yes, please. And as I was saying to you before we started recording, there's very much this is coming up a lot in clinic these days. I just sent off a referral yesterday to a physio who has experience with, in particular, the neurodiversity plus histamine concern. So we can talk about that in a minute, but kind of give me an idea. Like, start us off. Give us the training wheels version. Like, what in heaven's name are you talking about when you say histamine intolerance and mast cell activation syndrome?
Okay, and they're two different things. So we'll kind of go into what they are, what each one is. So histamine is a biogenic amine. So when our immune system detects an allergen or an invader, histamine is actually released primarily from our mast cells and our basophils as part of our immune response. So it actually increases permeability of the blood vessels. It allows immune cells to reach the area more quickly. It helps us with immune defense, inflammatory response. It actually helps us secrete gastric acid to digest. It affects neurotransmitter activity, wound healing, allergic reactions, and our inflammatory response. It actually purposely creates inflammation to get the pathogens or the invaders out. But the problem starts to happen is when we start to get an imbalance. So, I feel like histamine's the new cortisol. The cortisol has
Mm-hmm.
purposes, but when cortisol is out of balance, we have all these symptoms with our adrenals and we have, adrenal fatigue and all of those things occur. Well, histamine is the same way. So, as long as you have the invader come in, it does what it needs to do, the histamine does its job, and you are able to digest it and it leaves the body, then it's fine. But what starts to happen is we start to get an imbalance here. So I like to use the bathtub as an example. So when you have a bathtub, you need to, there's a plug and you're filling water up. So if you're pouring water into the bathtub and the plug's open, it's just going to keep draining and you're just going to have water come in and it's going to come out and you're never going to overflow. But if you either plug the plug or you're pouring too much water in or both, you start to overflow. And that's when we start to get symptoms of histamine intolerance. And so we need to look at it and make sure, one, we're not getting the overload of histamine, but two, that our body can process it. So I think one of the most confusing things about histamine intolerance is that we actually have 4 different histamine receptors. So it's not just about allergies. So I think when people hear histamine, they think of allergies and those kind of symptoms. But we can have nasal congestion, we can have sneezing, asthma, difficulty breathing, but like I mentioned, we can have headaches and migraines. We can have fatigue, heart palpitations, dizziness, anxiety. It can be difficulty concentrating, PMS, irregular periods, flushing, joint pain, inability to sleep, anxiety, hives, vertigo. Like there is a lot of different things happening in our body that could be actually from histamine that we're not really even associating with it because the symptoms are so broad.
Mm, so interesting. And you're right, we associate histamine with allergies. I
Hmm.
think mostly because the ads on TV talk about antihistamine, right? So we go, all right. But I know it's one of the things that I recommend for someone that has a new onset of dizziness or vertigo because it can just calm down these centers of the brain. In some people, not all, just depends on
Hmm.
what's going on. So you're saying that the histamine is actually a normal immune response that can go sideways.
Exactly. We need it, but we just don't want too much of it. So we need to be able to break it down. So you want to talk about how we break it down?
Yes, please.
Okay. So there's two different pathways for histamine metabolism. So you have one in your gut and then you have one in your cells. So in our digestive system, we need to break down histamine through an enzyme called diamine oxidase. And the diamine oxidase lives in the brush border of our intestines. And so when you're eating foods that are high in histamine, you need to be able to process it. So I think I like to use this as an example because a lot of people understand taking like a lactate when it's an enzymatic reaction. So if someone's lactose intolerant and you take a lactate, it helps you break down the lactose. It's an enzymatic digestive issue, where the same thing with diamine oxidase. So with histamine foods, if we can't break down the histamine in our food, we need more diamine oxidase. So there actually are diamine oxidase supplements that you can use to help you break that down. But we need to take a step back and say, well, really, the main thing is, why is diamine oxidase compromised? And that's usually because of dysbiosis. So we get the imbalance of the good bacteria and overgrowth bacteria in your gut, and you start to get this imbalance, and it starts to affect your mucosal layer, and then your diamine oxidase is compromised. So we also can see genetics. So I personally have genetic variants that make my diamine oxidase pathways less effective. But my histamine intolerance issues didn't start right when I was born. It's usually something else. So it's like, okay, yeah, you're compromised, but that usually you don't have symptoms unless we have other gut issues, and that actually starts the symptoms to come out. And so we can really, when we heal the gut and we rebalance the microbiome, we can see an improvement in the ability to digest histamine.
Interesting. I know I've heard once again, gut comes to the forefront.
I know,
Like
with
it's such
everything.
an important concept
Hmm.
for our
Yes.
overall health. And even when we're talking about things that don't seem like they're connected to the gut, you essentially just connected headaches to the gut.
Hmm.
I mean, a lot of
Oh,
other symptoms
huge.
too,
Yeah, huge. And so
right?
like let's just take a step back because this is an interesting thing. So I had someone who was having migraines, and they were, we were doing some of the migraine protocols, and they didn't see the change in the way we started. We're starting to get the right nutrients, some of those just to begin. So I do a stool test. I find a parasite. So the parasite is changing the microbiome. It's causing an inflammatory response, and it's affecting the diamine oxidase metabolism. And so healing the parasite actually stopped the migraines. So you're not thinking those steps when if you're listening, you're just thinking, okay, oh, it's a brain issue, it's a blood vessel dilation issue, but it's often not. And I think that's what we need to do in this world, is become health detectives. That's why I say to people, not only am I a detective, but you're a detective of your own body. And when you start to make some of those connections and seeing the foods that, maybe that avocado is bothering you, that you're eating because you're trying to be healthy, you need to start looking at and paying attention to, how do I respond to different things?
Yes. Just yesterday in the clinic, I had a new patient come in who was referred to me for vestibular work and
Hmm.
very specifically sent in by the GP and said, there's a problem with the crystal in the ear. Please do the
Yeah.
Epley's maneuver. Okay.
Mm-hmm.
So normally people come in without that information existing, right? And it's up to me to be the detective and figure out what's going on. So I'm taking his history, and I'm told that one of the medications that he is taking makes him dizzy every time he takes it.
Okay.
And his doctor recently added a second version of that same medication, so he's now taking two. So the problem isn't a crystal in the ear,
No.
right? And so, but trying to explain that to him was like, bro, you don't need me. You need to go
Yeah.
back to your GP and have the conversation about this medication, or talk to your pharmacist, please. Because, the pharmacist can make a different recommendation.
Mm-hmm.
So it's an interesting story, but it's another example of how we're taught in the system that there's a linear relationship between symptoms and
Mm-hmm.
causative factors in the body. And you and I, as functional medicine practitioners, know that quite often it's the other end of the body that's causing the symptom up here,
Exactly.
whether it's
Mm-hmm.
physical or chemical or whatever.
Yes, and what even makes it even more crazy, let's say, is that there are actually specific microbes that can be histamine producing and mast cell activating. So you can
Interesting.
actually have specific microbes in your gut that are causing it. So then you can go back and even ask the question, in some cases, is it you or is it your microbes? So are they causing, I'm going to share this story too, because I think sometimes hearing some of these are like, like we're saying, relate to, oh wow, how drastic these things can be. So I was working with someone a few years ago who had 20 years of full body urticaria, so full body itching. He was on several different medications, had tried shots. As soon as the medications would wear out, like these high doses of several different antihistamines, he would get, the full itching back. And it was just something like, so he says, I feel perfectly fine other than just this itching. And he can remember 20 years ago, the day it started. So because of that, there was a little bit of question because it was so specific when it started, whether he had mold exposure, but we did mold testing and it was fine, no mycotoxins. So he had no gut symptoms. And I said, well, we're going to do a stool test. And he's like, but I'm not having any symptoms. I'm like, well, we need to, we're still going to do it. So he had very high levels of Morganella, which is a strong histamine producing bacteria. We treated the Morganella, and within 6 weeks he was totally itching, like the itching had completely stopped. And I
Yeah.
mean, I think it's just like when people, it's so drastic when people are living with these things for a long time and just doing things in the right way. I think the other part I really want to stress here is that one of the problems is that a lot of the gut healing protocols that people are doing are not good for people with histamine intolerance. So
Ooh,
there's certain this, yeah, and that's a
tell
pretty
us more.
important thing
Yeah,
because
tell us more.
we're hearing heal the gut, but the things that you're doing can actually be exacerbating your symptoms. So for example, fermented foods, that they're high in histamine. So while they're good, and you're hearing fermented foods and bone broth is high in histamine. So you actually don't want to right now, if you have histamine intolerance, be doing fermented foods or bone broth. Also, even certain probiotics. So we know that, like we're saying, there's some histamine liberating bacteria. There's some bacteria that help histamine. So certain probiotics have the wrong combination of bacteria that can actually exacerbate your histamine intolerance. So kind of those staples that, we hear fermented foods, we hear bone broth, we hear probiotics, they're actually might not be good for you right now. And not that they can't in the future, but you have to really think about some of those things. And I think that's a message that I want people to hear, because it's, you don't understand, you're going to a practitioner, you're getting help and you're not feeling better, or you may be flaring, and we're not really, because we're not looking at it in this lens.
So interesting. So you mentioned fermented foods and probiotics, and there was one other that you mentioned in there that's a bone broth. Okay, so
Mhm.
what makes for histamine in there?
Yeah, so there's three different ways that you have histamine, so issues with the food. So you have foods that are high in histamine, and those are like the fermented foods, the aged cheeses, the cured meats, alcohol. So those are foods that are high in histamine. Then you have histamine liberators. So they are not necessarily high in histamine, but they can actually liberate histamine. So things like strawberries, tomatoes, bananas. I mean, well, like, and you're noticing all the foods I'm saying are healthy foods. So that's where
Mm.
it gets really confusing for a lot of people. Some people are like, these are all the foods that I actually eat.
Mhm.
And then we also have foods that limit diamine oxidase. So, like we said, we need the diamine oxidase to break down the histamine, and tea is one of the ones mainly that tea, we see that with alcohol. I actually created, my team and I created it. It's about 25 pages long of a list of foods that have, like, foods that are liberators, foods that are high in histamine, foods that are blocking diamine oxidase, because it's almost like we have like a cheat sheet and then a reference guide, because you're looking through and it can get complicated of where the foods are. So what about this food? What about this food? So we try to create that as a resource for people we work with, so you can really have kind of that ability to go back. And then also, one thing that you should do is, if you're listening to this and you're like, I want to start to investigate some of these foods, the response is not the same for every person for every food. So it's not one of those like every single person is going to react to each of these the same way. So also getting the idea that, okay, what the foods are, and then what's my individual response to that too. So if you're eating that food, okay, what is your response? What happens? Do you ever notice when you're eating maybe that your nose is running a little bit, that your cheeks might be a little red, your nose is hot? You're having a histamine reaction right there. I mean, and unless you're aware of that, that's, something I think people aren't even like, I'm a little bit like stuffy after I eat. Okay, I'm going to move on. But there is a reaction going on. So really to start to pay attention to your reactions.
So interesting. I've got a couple of questions. I'm just trying to decide which way to go first. So you've just mentioned, you've kind of answered one of them. I mean, if someone is histamine intolerant and you're not sure if you are, what kind of symptoms are going to come up when you eat something that causes a histamine reaction?
And this is where life gets tricky, I feel like, because it's going to be different for everyone. So if you're getting flushing, if you're getting a runny nose, if you're getting congestion, if you're getting a headache, huge digestive connection. So if you're getting bloated, the cramping, any of those GI symptoms can be. But some people, it's going to be anxiety. So that's where, when I'm talking about, I know that's
Wow.
what's tricky. Some people, their only symptom is anxiety after they're eating histamine foods. And so it's like those are the things that get complicated, because, like we said, there's 4 different types of histamine receptors. So
Mhm.
sometimes people, once they really dial in, realize, oh wow, these histamine foods are making me anxious. And I feel like when I'm not eating them, I'm less anxious, but my anxiety shoots up because of the way it's affecting their body. So it really can be, I wish I had like the exact answer, but it really can be variable, and it overlaps with so many other things that we're talking about. So that's where it's, because it's this whole body issue, it's overlapping symptoms that you might think of for other, like IBS. You could think, okay, I have IBS, but okay, is there a histamine component there too?
Mm, fascinating. Before I share a quick story that I think will segue us to mast cell, I don't know, we'll
Hmm.
see. We'll see. Uh, where, if someone is like, I think I might have problem with histamine, where do they go to find out information, and what kind of practitioner should they be working with?
Yeah, so I have a guide I'll give you for the show notes. It's just go.megmill.com/histamine.
Okay.
And it's about a 25-page guide that is essential guide to histamine intolerance, and it's going to explain what histamine is, the symptoms that you could be experiencing. It gives you lists of these foods. It also gives you some sample recipes that you can try. So we try to make it a very comprehensive guide to get started. So what you could actually do is just pull those foods out for a week or 2 or 3, just and see, okay, when I'm pulling these high histamine foods out, does it make a difference? How do I feel? So sometimes we're going to start to feel better when we're eliminating the histamine foods. Now, we don't actually want to eliminate the histamine foods forever. We need to get down to the root cause of why you need to. So our ultimate goal is okay, why are you having histamine intolerance? But it's one of those things that can be like, to calm yourself down, we can eliminate the, do some of the food eliminations and kind of see where you're feeling. But I would say, just, find someone. If this is something that I have a virtual clinic. I see people all over the world. We also have a histamine program called the histamine deactivation method. And there are other people out there that are looking at it from this lens, but just make sure that you're working with someone who is looking at it from this lens, because I get all the people that are mistreated a lot of times, because they already were working with someone who wasn't looking at it through this lens and not getting results, or sometimes getting worse.
Yes, yes. Completely understand. And unfortunately, I think Western medicine isn't up to speed on this the same way those of us in functional medicine are. Like, there's so much more to learn. And they're just a little bit behind.
Well, they're going to put you on antihistamines. So that's going to, that's their toolbox. So you're going to get a list of different antihistamines, and then that can help with symptoms, but it doesn't solve the problem. So do you want to live on antihistamines, and do you want to know, sometimes that's not even enough. So, are you still symptomatic on the antihistamines? Do you want to live on the antihistamines? Or do you really want to find out what's going on so you can bring your body back into balance and not have to? At this point, I can free eat. I can even eat high histamine foods, because I know, like, everything, I'm balanced. So that's my goal for everyone. It's freedom to be able to live your life in the way that you want to, because you have brought everything in your body back into balance.
I love that. It gives me hope as someone with a gluten intolerance. It gives me hope that maybe
Yeah.
someday there'll be a pill.
I know. I live
It's
at
not
gluten.
celiac, so I'm
Yeah.
hopeful it could be something
Yes.
else. Anyways, question, because I do hear questions about this very thing quite often,
Okay.
is what makes for leftovers being a high histamine food?
Oh, yes, that's a great question. I should have mentioned that earlier. So, histamine can actually grow in cooked foods. So, it can grow in, even if, that's a very important point. So, you meal preppers out there, you have to think about this. Yep.
Yes, this is me as gluten intolerant. If
Mm-hmm.
I don't, then I'm stuck at a place where I'm hungry and I've got nothing appropriate to eat, and then it's a problem. So, anyways, please go on.
Yes, exactly. So we have, so freeze your food. So meat, prep it and freeze it. Because
Okay.
when we freeze it, we flash freeze it, it helps the histamine not grow. So you want to really, if you are histamine intolerant or questioning it, you don't want to eat leftovers more than 24 hours. You also even sometimes have to think about how your meat, like, was, what was the process of, like, between the butchering, or the fish being caught to get to you. So how long has that meat been sitting out? Was it flash frozen? What was the quality of the meat? So sometimes we can even see that people with it, if it's been aged, if it hasn't been in the appropriate processing, like from when it was prepared to even to the grocery store. But then even beyond that, if you cook it and then you have it sitting in your refrigerator, it will grow histamine. So histamine will develop. So you do want to make sure that you are flash freezing, that you're not eating over histamines that are over 20, like, leftovers that are over 24 hours. And then really pay attention when you're going out to dinner, because you don't know when that food was prepared. So I formulated a diamine oxidase supplement. It's called HistaDigest. It's over at megavitalityshop.com. And I recommend that when you're going out to dinner, that you just take, if you're unsure. So if you're eating things are low histamine, it's probably fine. If you're eating things that are left over or you're not sure, I would take a diamine oxidase. And if you're going out to dinner or to a party, I also would recommend taking a diamine oxidase with your meal, because then you don't know how it was prepared.
Oof. Fascinating. Thank you for sharing that resource. That's super helpful. And it just goes to show you there's so many complex pieces and parts to gut health in particular, but also the symptomatology we can experience. And you just have to get yourself to the right practitioner in order to figure out what's going on. Okay, let me tell a little story that I think will
Okay.
transfer us from histamine to MCAS. Okay. my husband has a wasp venom anaphylaxis allergy. Okay.
Mhm.
And I have seen him from the time he was stung until the time he lost his airway. It was terrifying. So I've been there, and I was allowed into the emergency room, where he was actually had the double bore Benadryl on each side, right, just to get his. He was absolutely purple. It was a thing. Anyways, so goes to see the allergist. The allergist gives him exposure injections over several months, whatever. Now he has not had touch wood. He now carries an EpiPen with him, but he builds decks and fences in the summertime, so he's
He needs to be
exposed to
careful.
these things. Yeah, this is an occupational hazard for him. So he's a carpenter, and recently, a few years ago, I made us a salad with strawberries in it. Now, we don't eat strawberries very often. I don't particularly like them. I think I have some kind of a reaction to them, but I don't know. They were probably on sale at our organic grocery, and I went, oh, let's have those, kind of thing. And he had some of the same symptoms as his anaphylaxis, although he didn't lose his airway. But he had significant enough stuff going on that I took him to the emergency room anyways. Because if you've ever sat with somebody
Hmm.
when they have that anaphylaxis reaction, it's scary as hell, and you just don't mess around with it. And the triage nurse said, what has he eaten recently? And so I detailed what was in dinner, and she's like, yeah, strawberries are on that list. And I was like, wow. And so you mentioned strawberries earlier.
Hmm.
Now, I distinctly remember the ER physician saying to him at one point as we were being discharged to talk to him about mast cells. Because Aaron was saying, why is this happening if it's not, wasp venom? And I remember him talking about it. So I hope that's acting as a good segue, but I'd love for us to talk about how this whole, how this all unfolds for people that have had issues like my husband has.
Yeah. So basically, okay, so think about, let's just like take a little step back and talk about the immune system. So you have two layers of your immune system. So you have your innate immune system and your adaptive immune system. So your mast cells, so the innate immune system is just like ready to go. It's ready to fire. What's coming in? Let's protect us. Where the adaptive immune system is more targeted and it's tagging things. So like the wasp venom is going to be like he was tagged, like you are allergic. I'm simplifying, but you are allergic to wasps. Like we're gonna tag that. So, but the innate immune system is just okay. What do we need to do? How do we need to protect ourselves? So the mast cells are part of this. And when your body gets overloaded, so your immune system starts to become on high alert. So basically, think your immune system becomes angry. So maybe you've been exposed to mold. Maybe you've had a tick bite or something like a tick-borne illness or something like that. You have maybe a parasite or candida or some dysbiosis. Maybe you got a virus. Maybe you have some emotional stress. You have some trauma. All of these things are piling up, and it's basically activating your immune system in a way that your mast cells are starting to degranulate at things that are not appropriate. So we start to react to say things that are safe. So the strawberry in particular, if he was, so when we start to see mast cell activation syndrome, we start to see reactions to a lot of different things. So that's when you start to see, okay, now I even reacted to temperature changes. Maybe you start reacting to a lot of different foods. Like now my food, I'm getting down to maybe I can only eat 10 foods now. I'm starting to react to, different things. You're starting to get like hives on a regular basis. You're getting itchy. You can have digestive issues all the time. So it starts to be where your immune system is, like we said, reacting to all of these things that are safe. We start to get in this cell danger response because our body is thinking, okay, I'm always under attack. I'm always under attack. So when we think about stress, we think about it as emotional stress most of the time. So we're thinking like our to-do list, what we have going on in our life. But we also have biological stressors, we have physiological stressors, we have all of these other stressors. And when those are starting to when our body's bombarded with those all the time, we start to get this reaction. So one of the things that we have to do when we're working with mast cell, we have to find the reasons. So we have to say, okay, what is causing this reaction? So we need to do testing and figure out, okay, why are your mast cells degranulating inappropriately? And then we also often have to do nervous system work, because we have to teach your body that it's safe again. So we start to get in this inappropriate response. And so I like to just use this analogy. So if you smell if you were given a rose and you smell a rose, and you think, oh, that's a nice, pretty smell. Then you're given the rose again and you're told you have to touch a hot stove at the same time. Like, oh, that's a negative reaction. You don't like that feeling, and you have to keep doing that over and over again. And then someone takes that stove away from you and gives you the rose back. If you smell that rose again, you're gonna like cringe. It's gonna feel painful. You're associating, even though it's just a rose, you're associating it with that symptom of feeling like you were burnt. So we need to train your body again to feel that the things that you're around are actually safe for you. So we need to work on all of the root causes, but then also in neuroplasticity, some limbic system work, some somatic work, some vagus nerve work are very important pieces of mast cell activation syndrome, and I think overlooked a lot because we want to look at the biological factors, but we need to address those factors too.
Oh, so interesting. This is complex, right?
It's very complex.
I dare say there's not very many practitioners that can handle this well, and certainly they're not within here in Canada, in the public system anyways. So fascinating. So is it the same kind of practitioner that someone can look at working with? I mean, generally the practitioners, in my opinion, in my experience, that have experience with mast cell also can handle the conversation around histamine, because those two things are closely related in the immune system.
Absolutely, yes. Yeah, you
Okay.
need to. It's complex, and what is even harder is that a lot of people that have mast cell activation don't can't take supplements well. Some people can. So sometimes we can give supplements, but a lot of people also can't handle supplements well. So you're trying to do the things that you need to do, but we can't handle them, so because our body's reacting to everything. So you also have to work with someone who's not going to push you. Sometimes we have to be very patient, and you have to even microdose and take a little bit of it at a time, and be very patient in getting progress. But the good news is, when you're hypersensitive, there is study that shows that even a little bit of the supplement can sometimes give you a more benefit than someone who actually is less sensitive. So we're seeing that people are making progress even on smaller doses. So we just need to be patient. So I think, when you're on this journey, there is an element of being patient and sticking with it. It definitely is something that is a marathon, not a race.
I love that. As a doctor, I believe that one of the best aging breakthroughs of the last decade is qualia senolytic, and here's why. As we age, our bodies tend to accumulate senescent cells. Senescent cells are also known as zombie cells because they linger in your body long after their useful function, wasting your energy and nutrition, which can contribute to less energy, slower workout recovery, joint discomfort, and basically feeling old. Qualia senolytic is a clinically tested formula with 9 vegan, non-GMO, gluten-free, plant-derived compounds that help your body naturally eliminate senescent cells, helping you feel years younger in just months. And the best part? You only take Qualia senolytic just 2 days a month. It's an easy thing you can do to feel years younger, and it can literally transform how well you age. Go to qualialife.com/lovely to try Qualia senolytic. It's backed by a 100-day money-back guarantee, and use promo code LOVELY, all caps, to get 15% off. As always, I'll leave the links in the show notes. That's Qualia Senolytic at qualialife.com/lovely with the code lovely to age amazingly well. So, to go back to nervous system conversation for a minute, this is very much, and of course, this is one of my specialties in the clinic. So, I do work with people that have broken brains. And I often find that as I'm doing the retraining work around safety, I like the polyvagal work that is very applicable for me and easy to convey in the office, which again is that sort of teaching safety. I know you know what I'm talking about. But quite often the response I get when I'm giving someone these tools is that it? Give
I
me
know.
more. Give me more.
Yes.
Like I want to do something that's actually going to make a difference. I'm like, okay,
Yeah.
hold on, boo. Like this is one of
Hmm.
the most important things you can do. Do not underestimate the power of reverse engineering safety to the brain.
Hmm. I agree. I just was telling you I ran that histamine deactivation method program, and I had people with mast cell in there too. And every week I would say, now don't forget that this is, go back. This is like such an important piece. I can't tell you how much of an important piece this is. And I think you're right. People don't want, you want to take the supplements, maybe change your diet. I actually see people get so hung up on the diet. I mean, it's like drilling down to like, oh my gosh, I had a bite of a strawberry, and or there was hidden and or I can't eat, just eliminating all of these foods and
Mm.
so hung up there. And that, like we said, can be a helpful piece, but we want to get you better. And really, that nervous system work is key. So I'm with you. It might seem simple, but it's very powerful.
Well, and I think it speaks to something we were talking about earlier is that we have this sort of belief that, first of all, that more is better, number one,
Hmm.
and that something from the outside can be far more powerful than what's already on the inside. And, as a chiropractor, which is, of course, my training, we have this whole deductive model right from day one, which is what's causing the interference. Let's take that interference away so that the body can does what it does well. And that is such a simple thing, but so incredibly powerful. And it's easy for me to have that as my root cause. I'm looking for that root cause so that I can pull it up and say, okay, it's not just about the stuff on the outside, but more than anything, it's the stuff on the inside, which we have so much power over and we're not taught that. And so these conversations like this are so important because this is why I had a patient recently say to me, why is everyone telling me to meditate? She
Yeah.
has dysautonomia. Okay.
Okay. Hmm.
And I'm like, because it's probably the best thing you can do.
Yeah.
Right. And in
Yes.
in a way it works with what you've just said about the diet. Like I see that in I know you see it all the time too, where it's like women in particular are so locked down on exactly the 7 foods they can eat in exactly the right proportion. And that, of course, is telling the brain not safe, not safe, not safe, not safe, not safe over and
Yes.
over and over again.
Exactly.
Right.
Hmm.
And so, sometimes like I, mentioned celiac earlier, obviously, if someone is celiac and eating wheat, that is a problem. You're going to have system-wide issues that
Yes.
will affect the quality and length of your life if you choose to eat wheat when you're celiac. But that one aside, I think we could relax a little bit on a lot of these things and not be so vigilant. It is a form of
Hmm.
hypervigilance.
It is. I agree. I actually created also like a list of antihistamine foods to try to get people like, okay, these are safe foods. So let's expand your diet with these foods so that we can build exactly what you're saying, safety around eating more.
Mhm.
Because the hypervigilance, I absolutely agree. It's creating this fear of food, fear of eating. You can understand why. So
Mhm.
we're not trying to be unsympathetic because yeah, when you're reacting, you're scared, and we can see why. But we also have to work on that neuroplasticity, brain rewiring, and then also feeling safe in experimenting with new things, because once you do, then we see people are able to expand their diet, and it makes you happy when you can eat more. So
Yes,
definitely.
It's true. I think in a way the food intolerances, the food allergies hooks into those of us, in particular Gen X and the some of the senior millennials too, and the boomers for sure, that grew up in the diet culture, which is
Yes.
that, it kind of hooks into that psychology that says, okay, well, this is bad for me and I must stop eating it. Now, back then it was we were taught that to make ourselves thin, right?
Hmm.
Whether it worked or not is another conversation, but now I think it's just hooking into that. It's an easy hook into for sure. So such an interesting thing to share. And so tell the listeners, please, how do you know if you have mast cell activation syndrome?
So yes, there is diagnostic criteria. It's actually hard to get diagnosed with mast cell activation syndrome because you need to have certain markers sometimes over time and in when you're in a flare. So someone who's clearly has mast cell issues, if you're not actively in a flare, you're so one of the markers that we look for is tryptase. So, but your trip they want to see a tryptase level above a certain range. And but if you're not active in a flare at the moment, the tryptase might not be high enough. So there's a lot of people with these symptoms that are not truly diagnosed. And to be honest, I don't know that you need a true diagnosis. You're having symptoms, you're having sensitivities, we're having these things go on. We want to help you feel better and get to the root cause no matter what it is. So I think people can also get hung up on that diagnosis too, and trying to figure out that to get that. In some ways, it's a label of like, okay, now I know I have this, or I don't have this. But people come saying, well, I don't have it, but I feel like I do, and well, you're having all the symptoms. We're going to do the same thing.
Okay. I just want to briefly touch on this because it is a little bit of a controversial subject, and I don't, as a rule, much wade into that unless someone wants to talk about the patriarchy, and then I'm in there all day long. But um, but I would like to say to the listeners, we have seen mast cell activation become a regular conversation since having a mass vaccination event a few years prior. And so that means a couple of things. It means if you think that maybe your health has changed since the pandemic, chances are that is true for a lot of reasons. Number one, the amount of stress that we went through, but also it can be related somewhat to the health recommendations at the time. And I think the good thing about that, Meg, is that we're getting so much more awareness of these
Mhm.
issues and so many more tools, so much more research and conversations happening so that we can have uh, things that we can use to get people through whatever has caused their mast cell activation. How did I do there? Did I?
Yeah, I think that's perfect. I think that was
Okay,
well said.
good.
Whether it was the vaccine or you had COVID
Yeah.
and you then the thing is, this is another tricky thing. You may have felt fine after it, and then the symptoms started coming up. I often see a few months later. So
Yes.
maybe you had a mild case of COVID or you didn't really have any issues after the vaccine, but then a few months later, all of this started. Well, that's probably related. So we're also, so think about it as stacking blocks up. So it's like what got your immune system to the level. So it's usually not just one thing. It's usually the combination of all of the things that got you to tip over and actually go into this hypersensitive state. And even with histamine intolerance, we'll go back to, I'm going to just go back there for a minute because this is an interesting point. Um, with women's cycles, so estrogen, just to go back into hormones for a minute, estrogen actually there's receptors on mast cells for estrogen. It actually stimulates the mast cells to release histamine. So that's why even at different times in your cycle, you
Mm,
might have different levels of
interesting.
histamine reaction. So maybe you can, wine is one thing I see. Like maybe you can drink a
Mm,
glass of wine at one point in your cycle, but then maybe when you're ovulating and your estrogen's up, or maybe in that luteal phase, or right, you do something like have an avocado or drink wine or something, and you're like, oh, now I'm noticing symptoms. Well, it's the buildup. It's like what's tipping you over.
Mm,
So we want to think of, okay, what are all the things, and then we have to bring all of those things back into balance. Got a
right.
little off topic there, but
No,
I
that's
thought
so,
that was
so
an important
relevant.
point. Mm-hmm.
Yes, yes. Much thought will come of that. So thank you for sharing that little nugget because that's so helpful. When you were talking, I was thinking, was that when I stopped being able to tolerate red wine? Somewhere in my 30s and early
Mm-hmm.
40s, just could not tolerate red wine anymore, which is fine because white wine is lovely. And now I don't drink any of them.
Yes.
So, is that what it was? Was it a histamine response
It
potentially?
could be because think your estrogen was,
Mhm.
your progesterone was going down. Progesterone actually
Yeah.
helps us metabolize histamine. And
Okay.
that's why sometimes when you're pregnant,
Hmm.
you actually, some of your symptoms change. So people that are having histamine symptoms and then get pregnant, well, some they'll go away sometimes because we have an increase of progesterone. So progesterone helps digest histamine. Estrogen releases histamine from mast cells, and it actually can compromise diamine oxidase. So when we start to get that perimenopause imbalance, that can play a factor.
Gosh, not that long ago, I had a patient say to me that she thinks she has a progesterone deficiency that's been lifelong because she said she never felt better than when she was pregnant. And
Oh,
you
yeah.
kind of
Mm-hmm.
just explained it, right? I mean,
Yes.
there's a
Mm-hmm.
lot of different ways that things it could be, but it could absolutely be a histamine problem as well.
Yes,
Wow.
absolutely.
Wow. Okay, let's bring this home sort of with the last question or query I have for you,
Okay.
which is I'm hearing a lot about, first of all, neurodiversity. So whether that is someone on the ADHD scale or it's somewhere on the autism scale or those of us mad geniuses that just have the ability to get hyper focused on things.
Yes.
The more I learn about neurodiversity, I was like, oh Lord, that's a lot of me.
Yeah.
You're like, I knew that from the way you wandered through that last story. Anyways, I mean, this is a beautiful thing about the neurodiversity conversation right now is like I start to recognize the people in my life and
Mm-hmm.
certainly my patients who are somewhere on that spectrum. And, it's not, it is absolutely not a bad thing. It's a superpower and we need to
Yes.
embrace it as such. But of course, most of us grew up in the Ritalin era and
Mm-hmm.
the labeling for schooling era. And then of course in our brains it just goes, well, it can only be a bad thing. Anyways, that's a conversation for another episode. But what I'm wondering is I have heard about both mast cell and histamine associated with neurodivergence. Do you have any intel on that? Because it's a little bit thin on the ground, and I'm wondering if you've heard of this, can share any information, please.
So I think it goes back to the beginning when we were talking about the different types of histamine receptors. So, like we said, it's a whole body, when we're looking at histamine, it's actually a whole body issue because we have different types of receptors. So, we have, I'm just going to kind of go through them quickly. So,
Please.
your H1 receptor is found in your smooth muscle, your endothelium, that's inner lining of the blood vessels, the central nervous system. Then we have your H2, which is predominantly located in the stomach lining. So
Hmm.
that's where like the H2 blockers, a lot of the stomach symptoms come in. Then we actually have an H3 receptor, which is found in our central nervous system and our nervous tissues. So it functions as a presynaptic receptor, and it actually releases histamines and other neurotransmitters like acetylcholine, norepinephrine, and serotonin. So we're seeing that can make a difference there.
Hmm.
Then we have the fourth one, which is in our bone marrow and our white blood cells. But so when you're, and that's where I'm saying even with the anxiety, that's sometimes the only symptoms. So the neurodiversity kind of can come in there because it's affecting our brain and our neurotransmitters and things like that. So I think that it's just, I hope we learn more and more that it's not just an allergy symptom. It is this whole body reaction, and it plays out differently in different people for symptomat.
Interesting. And thanks for bringing that all together because, this is a subject that can be kind of difficult even for those of us seasoned practitioners to wade through. So I appreciate the histamine masterclass that you just gave us and the immune system
Yes.
101.
Yes.
I'm like checking boxes in my mind as you're talking. I'm like, oh yeah, I forgot about that. Oh yeah, that one's cool too. Oh yeah,
Yeah.
right. That was a board question 1,000 years ago.
Yes.
So thank you for that. So if people want to know more about you and your work, Meg, where can they find you, please?
Yeah, so I have my website is megmill.com. So that's Megmill. Like I said, if you want that free guide, just go to go.megmill.com/histamine. I have a podcast called A Little Bit Healthier. So we're over there talking about health tips. And I'm over on Instagram at Dr. Meg Mill. And I'm actually starting a new YouTube channel called Histamine Intolerance Heroes. So I
Nice.
get so many questions, and even like what products help and devices, and we're talking about like vagal nerve things. So I'm actually creating a channel that's just focused on this, where people can go and watch specific little videos to help, really, because it is a complicated issue. So I'm trying to use my FAQs to get information out there.
Yeah, that's great. Any information that's about this particular subject, because it is something, again, we're seeing more and more of, and anything is helpful. So thank you for doing that. Thank you for
Yes,
launching.
absolutely.
Thank you for coming on the show. Now, I have the two final questions to
Okay.
ask you. The first one requires a little bit of lead up. So, I have become aware in the last year that in countries around the world, there are very female supported practices that are provided by the government to the citizens of the country to help women heal. For example, in the Netherlands, women are provided a night nurse for the first several weeks after they've given birth so that mom can heal and sleep while someone takes care of baby overnight.
I
Revolutionary,
know. Oh my gosh.
right?
Revolutionary. Yes.
Revolutionary. So here in
Hmm.
Canada, we have
Uh-huh.
maternity leave that's a full year, and the fathers can take it
Oh,
too.
wow.
So it can be, I think it's called parental leave now. So it can be whoever's birthing and whoever's at home with babe. And that is a paid leave here in Canada. And I do understand that in the United States, that is yet to happen, which is bananas. Isn't that
Hmm.
bananas?
I had 6 weeks with my youngest, and I had three kids. It was like back to work with three kids that are under four, or four and under, and working. Yeah.
Crazy. That's crazy. It's
My
nuts.
husband had 2 days off, so I'm with you.
Come
Yeah.
on. Anyways, okay, we won't go there. Put it down,
I
Fiona.
know.
Put
I
it
could.
down.
I could.
Down, girl.
Yes.
Okay, so now we know Canada is on the verge of providing HRT to anyone in the country that wants it. BC, British Columbia is the first province to do it. They also provide contraceptive care, and the um, National Health Society (NHS) in the UK also provides hormones for women. Okay, at no cost, so anyone has the availability to have it. If you could design your own menopause leave where your government supported you for a year and you were either offered a fund that you could pull from or you were able to use any kind of practitioner or service or yoga studio or travel, whatever you felt would be most supportive in your perimenopause and menopause era, what would you include?
So in this, we can include like HRT. So
Yes.
I think education on hormone. I think providing HRT and then education around it. So what it means, how to do it the right way, how to monitor, really getting that under, because I think it's something that's one of the things. I think there's a lot of misconception from past inaccurate studies that people have a fear around HRT. So I see so many people
Absolutely.
saying like, "Oh, I don't want to try it. I can't." So
It'll give
really
me breast
understanding.
cancer, that kind of thing.
Mhm.
Yep. Hmm.
And understanding you're maybe in about, like, really, let's plan that you could get an evaluation of your own unique risk factors based on your own health history and your
Mm.
family history, and then an explanation of why, and then what you need to do and how you need to be monitored. I think would be a huge thing. I think also, yes, appropriate exercise for that time. So whether that is yoga, Pilates, things that are less high intensity, but for specifically for a women in that time of life to be able. And then another thing actually is sleep, because we start to see so many sleep disturbances. So really education on how to keep your environment in the best optimal way to be able to sleep, and the importance of sleep, and things almost like sleep coaching can be helpful, because we see a lot of sleep disturbances come in that phase. And then I think additionally I would add some metabolic health information and training,
Mm.
a CGM to be able
Mhm.
to monitor your blood sugar, and really that's a time where really focusing on good metabolic health is important too.
Great. I love it. Final question. Knowing what you know now, what would you tell your younger self?
I think it's just that life is a journey. So I think, that's the thing when you're young, and everything seems to be like, oh, this is the biggest deal. And really, we have so many things that we're going to go through, and really looking at all of the experiences that you go through build who you are, and whether they're positive or negative. Some of our hardest like trials and tribulations actually have the greatest reward in the end. And I think that's really hard to see when you're young, but
Mm.
really just embracing each experience, because on the other side is going to be something new that you never expected.
Oh, that's great advice. Dr. Meg Mill, thank you for coming back to the show. Thank you for bringing all of your great information and advice to us. I really appreciate it.
Thank you so much for having me.
The information and other content provided in this show, or in any linked materials, is not intended and should not be construed as medical advice, nor is the information a substitute for professional medical expertise or treatment. We are doctors, but we aren't your doctor. Seek your doctor's opinion. If you or any other person has a medical concern, you should consult with your healthcare provider or seek other professional medical treatment. Never disregard professional medical advice or delay in seeking it because of something that you have heard in this podcast or in any linked materials. If you think you may have a medical emergency, call your doctor or emergency services immediately. The opinions and views expressed on this page and in this show have no relation to those of any academic, hospital, health practice, or other institution. Thank you.